Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what is the function of antithrombin 3? Answer: inactivation of thrombin and clotting factors. Question: what is an isolated increase in serum ALP commonly indicative of? Answer: Paget's disease of bone. Question: what kind of pneumonia does Haemophilus influenza cause? Answer: bronchopneumonia. Question: what is the genetic inheritance of neurofibromatosis 1? Answer: autosomal dominant. Question: how does insulin sensitivity change in acromegaly? Answer: decreased. There is insulin resistance. Question: what is the most common gene mutation in autosomal dominant polycystic kidney disease? Answer: APKD1 on chromosome 16, 85% of cases. Question: what does the first A in Apgar score indicate? Answer: appearance, skin color. Question: how does partial pressure of oxygen change in methemoglobinemia? Answer: normal. Question: which cancer is associated with nitrosamines? Answer: gastric carcinoma. Question: how does metastatic cancer to the lung commonly present upon imaging? Answer: multiple cannonball-like nodules. Question: what is the most common type of delusion? Answer: persecutory. Question: why is a horseshoe kidney located abnormally low in the abdomen? Answer: it gets caught on the IM or root during its ascent from the pelvis. Question: what is the most common germ cell ovarian tumor in children? Answer: endodermal sinus tumor. Question: which anemia is associated with basophilic stippling? Answer: anemia of chronic disease and thalassemias. Question: which autoantibodies involved with systemic lupus erythematosus, SLE, are associated with false positive VDRL tests and paradoxically elevated PTT? Answer: anticardiolipin antibodies. Question: what type of tissue calcification is associated with normal serum calcium? Answer: dystrophic calcification. Question: which type of inflammation presents as a delayed response but with more specificity as part of adaptive immunity? Answer: chronic inflammation. Question: which cyclin CDK complex functions to phosphorylate or be bound to E2F? Answer: cyclin CDK4. Question: what is cancer cachexia? Answer: a loss of body fat, wasting and profound weakness during cancer. Question: what is the normal MCV range? Answer: 80 to 100 cubic micrometer. Question: what cancer is associated with diethylstilbestrol? Answer: clear cell carcinoma of the vagina. Question: which bacteria is associated with overgrowth in the gallbladder wall due to impacted stones in the cystic duct? Answer: Escherichia coli. Question: what is the genetic inheritance of Alport syndrome? Answer: X-linked. Question: which cell layer of the breast ducts and lobules has contractile function and propels milk to the nipple? Answer: myoepithelial. Question: which sex is more commonly affected by Sjögren syndrome? Answer: females, 40 to 60 years old. Question: which race is more commonly affected by keloid? Answer: African Americans. Question: which monoclonal antibody increases the risk of progressive multifocal leukoencephalopathy? Answer: natalizumab. Question: what type of cells are proliferating in a liposarcoma? Answer: lipoblasts. Question: what genetic defect occurs during the full-blown carcinoma stage of oral squamous cell carcinoma? Answer: overexpression of cyclin D. Question: at which cerebral vessels are Charcot-Bouchard microaneurysms typically found? Answer: lenticulostriate vessels. Question: which demographic is most commonly affected by Riedel's fibrosing thyroiditis? Answer: younger and middle-aged females, less than 40 years old. Question: which virus is associated with focal segmental glomerulosclerosis? Answer: HIV. Question: which metabolite of urobilinogen makes stool brown? Answer: stercobilin. Question: which cell layer of the breast lobules is responsible for producing milk? Answer: luminal, inner, cell layer. Question: what type of autoantibodies are involved in myasthenia gravis? Answer: autoantibodies to postsynaptic acetylcholine receptors. Question: which cytokines released from macrophages in response to pyrogens increase cyclooxygenase activity? Answer: IL-1, TNF. Question: which middle ear bone is common involved in otosclerosis? Answer: stapes. Question: where are Lewy bodies found in Lewy body dementia? Answer: cortex. Question: which neurons are most vulnerable to toxic metabolic disturbances? Answer: reticular activating system, RAS. Question: which blood vessel is a common route of metastasis for renal cell carcinoma? Answer, renal vein to IVC. Question, which type of bleeding disorder involves microhemorrhaging, for example petechiae, purpura, mucosal bleeding? Answer, platelet disorders. Question, what cardiac complications are commonly seen 0 to 24 hours post-MI? Answer, arrhythmia, heart failure, cardiogenic shock, death. Question, what is the etiology of Viscott-Aldrich syndrome? Answer, WASP mutation. Question, which cancer is associated with Helicobacter pylori? Answer, gastric adenocarcinoma, malt lymphoma. Question, what is the key characteristic of necrotic bone that differentiates it from normal bone? Answer, empty lacunae. Question, what causes an embolic stroke? Answer, thromboemboli. Question, what is the earliest sign of jaundice? Answer, scleral icterus. Question, which immunostain is positive in melanoma and differentiates it from Paget cells? Answer, S100. Question, how does percent transferrin saturation change in anemia of chronic disease? Answer, no change. Remember, serum iron and TIBC decrease in ACD, typically in proportion to each other. As a result, percent saturation does not change. Question, which chromosomal disorder is associated with the infantile type of coarctation of the aorta? Answer, Turner syndrome. Question, which enzyme in the intrinsic mitochondrial pathway of apoptosis functions to maintain the integrity of the mitochondrial membrane? Answer, BCL2. Question, which oncogenic virus is associated with nasopharyngeal carcinoma? Answer, Epstein-Barr virus. Question, which type of hyperparathyroidism is associated with hypercalcemia? Answer, primary. Question, which form of polycystic kidney disease is associated with Potter sequence? Answer, autosomal recessive, if severe enough. Question, where does stomach adenocarcinoma metastasize to? Answer, Virchow's left supraclavicular node. Question, what cancers are associated with chromium and nickel? Answer, lung carcinoma. Question, how can we prevent uric acid nephropathy in patients receiving chemotherapy for lymphoma leukemia? Answer, increase urinary pH, alkaline, to prevent precipitation of urate. Question, which gene is closely associated with mucin-assisted enocarcinoma of the ovary? Answer, KRAS. Question, what adhesion protein is lacking in the malignant cells of invasive lobular breast carcinoma? Answer, E-cadherin. Question, which protein marker is positive in melanocyte as it is a derivative of the neural crest? Answer, S100. Question, which type of joint are Heberden nodes located at? Answer, distal interphalangeal joints, DIP. Question, which enzyme functions to primarily eliminate hydroxyl radicals? Answer, glutathione peroxidase, uses 2-GSH in the process. Question, which enzyme converts arachidonic acid into prostaglandins? Answer, cyclooxygenase. Question, in which section of the colon does colorectal cancer present as an infiltrating mass with partial colonic obstruction, colicky pain and hematochezia? Answer, descending colon. Question, how does serum alkaline phosphatase, ALP, levels change with increased osteoblast activity? Answer, increase. An alkaline environment is needed to lay down calcium ion. Question, what cells are proliferating in rhabdomyosarcoma? Answer, rhabdomyoblasts.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.